Good afternoon, everyone. Thank you for joining us. Unfortunately, the grim reality of this virus is here, and it's going to be with us for a while. And we've lost 3 individuals to death in our community. Obviously, this is very tough on their families and certainly the community at large, as in this process we can't even grieve the way we normally grieve, with limited wakes, limited funerals. So we're all thinking and praying about those who we've lost. 3 individuals, an African-American woman in her early 70s, a Caucasian woman in her 90s, and a man in his 50s of another race. All 3 had underlying medical conditions. We've now lost 29 neighbors to this virus, and certainly we think of their families and all of them at this time as well. Related to cases, we have 841 cases now. This is up 22 cases from yesterday. We have 37 individuals that are in the hospital. This is down 3 from yesterday. 37 people represents 14%, 1/4 of our active cases. That percentage, when we look back 10, 14 days ago, was close to 20%. Now it's down to 14. We have 8 individuals that are in critical condition. This is down 2 people from yesterday. This number is now representing 3%. Again, at 2 weeks ago, that was anywhere between 8 and 10% of our active cases. So certainly we're happy that there's only 8 people in critical condition at this point. Again, these folks are in tough shape, and we need to pray for these folks so that they get better. The grim reality is folks who have underlying medical conditions that get this are in a fight, and sometimes it's a losing battle. When we break down who's in the hospital right now, we have 18 Caucasian, 9 African American, 3 of another race, and 7 individuals who have yet to share their demographic data with us. So that's kind of a breakdown by hospitalizations. Related to recoveries, this is our green curve to the left, and our green curve to the right is our regional green curve. Right now we're up a lot of testing this week. A lot of our positives are from proactive testing in buildings that we knew the virus was there at one point. We wanted to go and hunt out possible infections. We found them. We now have people in quarantine working with the medical teams in those buildings to make sure people are getting the help. Out of our 22 cases, 11 of them are either a contact of a household. That's 3 new contact cases and 8 new cases affiliated with senior living facilities. So we have 11 community spread cases. Again, when we look at the randomness of the infection, throughout the majority of this process, almost all of our cases have been community spread after the initial slew of travel cases. Now we're seeing over half of the cases are either driven by proactive testing in senior facilities or driven by contacts of people that already had COVID-19. Why is that different? Why does that matter? It matters because we already, with folks who are in senior facilities right now, essentially these folks are already in a quarantine situation. It's very easy to get your arms around quarantines in that process. If you are a contact of someone who's already positive, you're already in a quarantine situation. So the ability for these individuals to spread this to the community at large is limited. So we now are breaking those out in our data points, and it's really our contacts, which are more random. And when you look at just our contact numbers over the last 3 days, we had, and even before then, this has been the trend. You had 5 one day, 3, 11. better numbers related to where we were a couple weeks ago, where we were having 19 and 20 and 18. So the numbers are going down. That's been the trend with that. We're seeing demand at our testing facilities related to your symptomatic testing going down. And really the bulk of our testing right now in the community is proactive testing of employees and proactive testing of residents. So all good news related to testing, where our positives are coming from. What's not good is the fact that this virus kills people, and it's going to continue to threaten our neighbors who have tested positive, specifically our elderly with underlying medical conditions. So we're winning many aspects of this fight right now, but we're still getting punched square in the mouth every time we lose a resident of our community. Right now, over 60% of our active cases are related to senior living facilities and contacts of COVID patients. So if you look at that, that shows you that the community spread is less and less prevalent in our active cases now. We now have 934 people in isolation or quarantine. That number's down from yesterday. Out of our positive cases, 476 females, 365 males, 26 are under 19 years of age, 158 in their 20s, 113 in their 30s, 120 in their 40s, 142 in their 50s, 126 in their 60s, 75 in their 70s, 52 in their 80s, 29 in their 90s. Breakdown of percentages by age. Again, these numbers have started to be skewed because the majority of the tests coming in now are seniors living in facilities. So they're skewed, but they're still positives, right? 22% are under 30 years of age, 35% are under 40, 50% are under 50, 66% are under 60, and 34% are over 60. Breakdown of municipality. City of Syracuse, 377 total cases, 220 people have recovered, 157 active cases. Clay, 84 total cases, 63 individuals have recovered. We have 21 active cases. Onondaga, 68 total cases, 23 recoveries, 45 active cases. Manlius, 51 total cases, 38 recoveries, 13 active cases. DeWitt, 43 total cases, 29 recoveries, 14 active cases. Salina, 43 total cases, 31 recoveries, 12 active cases. Camillus, 33 total cases, 28 recoveries, and 5 active cases. Cicero, 29 total cases, 24 recoveries, 5 active cases. Lysander, 27 total cases, 18 recoveries, and 9 active cases. Geddes, 27 total cases, 18 recoveries, and 9 active cases. Pompey, 20 total cases, 19 recoveries, 1 active case. Skaneateles, 15 total cases, 12 recoveries, 3 active cases. Van Buren, 5 total cases, 2 recoveries, 3 active cases. Marcellus, 4 total cases, 4 recoveries. Atisco, 4 total cases, 4 recoveries. Lafayette, 3 total cases, 2 recoveries, 1 active. Elbridge, 2 total cases and 2 recoveries. Fabius, 2 total cases and 2 recoveries. Spafford, 2 total cases, 2 recoveries. And Tully, 2 total cases and 2 recoveries. Related to testing, it's becoming harder and harder to get the total number of tests that are outstanding in the community related to all the new testing that's coming online in various facilities. Getting all these numbers has been a lot of work and coordination. We're hoping to be able to get that number reported. It's important because it shows the percentage of the community at large that's been tested. Certainly, we're getting to the point where we're getting close to 3% of our community, which is important. So we don't have that number right now. I know we have about 350 tests outstanding, not counting the Walmart testing site. and we've had over almost 225 of those are proactive testing, so it looks like we have about 125 outstanding tests related to symptomatic testing, but we hope to get those numbers back and have accurate information to report on that. We get positives every day from the labs and from New York State, so our positives are always real time. Just the negative results are the ones that we haven't been able to catch up on. So we're working on that right now. But certainly look at our proactive testing has worked. We believe that there was either the potential threat of COVID going through our senior centers with assisted living and our independent living facilities and nursing homes. Everybody's been proactively testing, employees and residents. Due to that, we're identifying the positives. We're eliminating potential risk to the public and to residents of these facilities that don't have COVID-19. And we know that we got to get these people help and get them better. And so that's what the goal was. The goal was by doing all of that, we would save lives, and that's the goal throughout this process, is to save lives. We talked about gaps in investigations, how we would share those with the public. We talked about 2 specific cases yesterday. I'm going to reiterate the times. Again, these were employees at these 2 businesses. They were wearing masks. The businesses were following CDC guidelines, but even though they had masks on, we're still letting people know to be aware. If you shopped at the Target on Route 31 in the town of Clay on Sunday the 19th of April, Monday the 20th of April, and Tuesday the 21st of April between 7 a.m. and noon, please be very cognizant of your symptoms. If you're feeling sick at all, take your temperature. Look out for the new symptoms that the CDC is talking about, sore throat, loss of taste, etc. And if you have any questions, please contact your doctor. If you went shopping at Walmart on 6438 Basil Row in East Syracuse on Tuesday, April 21st from 4 p.m. to 11 p.m., or Wednesday, April 22nd from 3 p.m. to 10:30, again, there was an employee, they were wearing a mask. They've tested positive COVID-19. That does not mean that you had direct contact with them, but we want you to be very cognizant if you were there, and certainly watch your health, contact your doctor for a consultation if necessary. We've talked about social distancing. It's working. The data continues to prove that. There's been a lot of conversations about didn't meet that curve, or these projections didn't happen, worst case projections. Everybody's been trying to scare us. The reality is we're glad that the worst case scenarios never happened. Part of why they didn't happen was because of the efforts of everybody in the community and everybody really taking this seriously and starving the virus. And so certainly strong arguments could be made if we didn't change our behavior and do what we did. We could have met those projections, and we could have had a serious problem on our hands. But we responded. The community was up for the challenge. I know our community continues to be up for the challenge with social distancing. Please continue to work with us, and thank you. I really want to thank the parents as well with what you've done with your children, and I want to thank the kids. Kids are having a hard time in this, and most of the kids are stuck on their property and have been for over a month, and you guys are doing a great job, and it's going to get better, and certainly we're very proud of all of our children. Related to Restart, we heard more information from the governor today. Happy to take questions on that later. Certainly we're working with our partners, exchanging a lot of great ideas and having conversations with the state. Glad to see more details from the governor today. We think our region will be ready and poised for a restart. We have the infrastructure in place to make it happen. Elective surgeries, again, there's some confusion today in various reports. We've been saying we meet the guidelines to start electives. The state has agreed with us. So elective surgeries in our county will be able to happen. I think the state's going to give out some guidance. Certainly, there's been a steady decline in hospitalization rates in our community, and our hospitals are nowhere near 70% capacity with hospital beds. So we're happy with that. That's an important aspect of our economy. There's a lot of people right now that need surgery that are sick. We're not talking about beauty surgeries here. People are sick. They need to get surgery to get better. It's part of public health. So it's also good for the economy for some of these employees who've been furloughed to get back to work. It's good for the supply chains. So very happy about that. Certainly, we're not supportive of selective surgeries that require rehab in a nursing home. That's a no dice, not allowed, and we're working with our hospitals and partners there related to that. Looking at some of our lines, and then we'll take some questions. Our upstate triage hotline, again, this is our testing triage site that's been so critical in this process for getting us where we are today to be able to talk about a restart. That phone number is 315-464-3979. Contact that number. You'll talk to a professional. They'll screen you for symptoms, make the referral to the testing site. Our seniors healthcare worker and adult nutrition hotline, 315-218-1987. This is for folks who need help with a meal, need help getting groceries, haven't been able to get to the grocery store when they go, what they need isn't there, toiletries as well. Please call that line. We have volunteers who've been really staffing this. The amount of meals and groceries and other things that have been done has been amazing. The response has been amazing from the community at large. Child care solutions, daycare. Daycare is a critical element of what we're doing today. It will be a critical element moving forward. We have very good daycare infrastructure in our community. We have daycare slots available to essential workers, 315-446-1220. And mental health is a serious challenge. If you need help, nothing to be ashamed about. Please contact 211. They can help make referrals, help give you strategies for you and or your family members. Let's take care of each other. Part of that in this trying time is taking care of our mental health. So again, please contact 211. Questions?
Governor Cuomo said today he doesn't see the state fair happening unless, the state reopens. What are your thoughts on that? When will a final decision be made?
Yeah, I think I saw what the governor said, and it makes sense if you look at it from the standpoint for if New York City and Long Island in late August are not really open, or other businesses like the fair that could attract people aren't open, it will be very difficult to have a fair. And so I understand the governor's perspective. Yesterday I said I'm hopeful that we'll have a fair. I'm still hopeful we'll have a fair. But it's a state fair. It's the governor's campus, the state campus. And certainly if New York City's in a position where they're still shut down 4 months from now, that will mean this virus is very prevalent in New York State still, and that the fair would be pretty risky to have an outbreak in our community, because many of these people come from out of the area, but many of these people are our neighbors that go to the fair 3-4 times at least during the fair. There are many who go every day, and they plan all year to go every day. So certainly we agree with the assessment that if other parts of the state are still shut down, that means we still got a major problem.
We knew last week that the hospitals couldn't resume elective surgeries today. They have to get their staffs back and plan and schedule the surgeries. But there seems to be confusion as if they're eligible. It seemed to come up with the governor today. I've seen reports that they aren't ready based on the 10-day hospitalization requirement. Do you know about each specific hospital and if they have to go ahead and what they're planning?
We have a graph over here. That's the hospitalization curve. I've been asked this question. The hospitals have met that guideline. We saw the state's guideline. We disagreed with the reports. You have the trend from the peak. The idea that if you have 10 new hospitalizations during a 2-week period, but you've discharged 50 patients, that you can't do electives makes zero sense. So I think it was interpretation differences is what was happening. Our position is we've met the guidelines that the state put forward. I heard Jim Malatras from the governor's office say the same thing today, so I think we're looking at the same interpretation, and we'll be able to do elective surgeries in Onondaga County.
The hospitals and you have the same interpretation?
Well, our interpretation as the regulatory agency is yes, and the state as the regulatory agency is yes, so that's who the hospital should be listening to.
Ryan, you mentioned that we're getting close to have tested 3% of the population, and I think one of the guidelines the governor laid out for a restart today sounded like 3% testing per month, something in the ballpark of 14,000 tests a month. Are we anywhere near being able to do that?
I think so. I saw that, and could we do it now? I think we could, Tim. The question is, how do you do it? From the demand related to symptomatic conditions in the community has been not even 3% since March 16th, so you had over a month. We believe by starving the virus that demand's going to go down, so you really need to be doing loads of proactive testing. So I think what we would do is we would look for guidance on what kind of proactive testing do you want it, how do we do it? I know that we talked about essential employees. Right now, your healthcare workers and nursing home workers and first responders can go get testing at any time at any of our facilities. So we can meet the demand because you have so many labs coming on. And I think the governor talked about Central New York, 179 locations. He's counting, I think, the pharmacies now, too, that he's been working on that. And that makes it hard for us to get real-time data now. Think about it. If we have 179 locations doing testing, how are we going to get the negatives every day from that? That will be very difficult to get real-time data. So we can do it, but how do you put it into a plan for how you're doing it? Before the CDC guidelines, that's how you tested. And based off the CDC guidelines, the demand wasn't even 3% in our community for 45 days. So that means you got to do a lot more proactive testing in various parts of the community.
Okay, but you think we have the capacity if there's a protocol for why you would test?
Yeah, with that many sites, and looking at what each kind of site can do from a capacity on a daily basis now, certainly you can meet that demand.
So where are we in the development of those sites? You mentioned now that it's getting harder for you to get the testing data every day because I think you've been going out and getting that phone call, right? How many new sites are there now?
So we're waiting. I believe most pharmacies are going to now be doing this. That the state's working on that plan, so I'm waiting to understand that. But easily a day between our 6 testing facilities, you're looking at a capacity of at least 1,000 tests a day that can be done. So if you look at that over the course of 30 days, certainly you can put together 13,000 to 14,000 tests. Test kits are something that when we've been getting our hands on, we've been building up stockpiles. You heard the governor talk about PPE stockpiles and preparing. Certainly that's something we're doing and we're continuing to do. So certainly if part of the plan is you got to do 13,000 or 14, whatever the number is specifically, for a restart per month, can we meet that? Can we check that off? Yes, we can check that box today. But understanding where you want to do that testing, I think you need a plan for where you want to do it. And so we'll need to talk to our state partners about what they have in mind about that. Because again, your regular demand in the peak of this, throughout this process, doesn't even get you to 3% over 45 days. Now the CDC guidelines, the demand's less and less as you see our community spread cases are going down less and less. So certainly we're going to have to be doing, the majority of this will have to be proactive testing.
Do you know if any local pharmacies are doing testing currently, or is that still in the works?
I think that's still in the works. I think the state's working through that.
So right now, it's still basically the 6
Yeah.
places of testing?
Yep. Yep.
With the weather improving, do you foresee a struggle now that there's a lot of hopeful news in the data and people are more attracted to going outside? Do you foresee another struggle about convincing people to social distance?
It's going to get harder. I think people need to be smart, wear a mask. I worry more about your social gatherings, your family functions, than people congregating in parks. But it's certainly going to be harder. I think we got a lot of rain this week, so that's good, Andrew. We go week by week with these things, you hate to cheerlead against for good weather, but that's kind of where we are when you're in this crisis the way we are. But I think people get it now, right? I think they get it that this is a tough virus. We don't know a lot about how it behaves, so we have to do our part to have success as a community. We need success because we have to get this economy open. That's going to help people with their mental health, and that's going to help with the ability for governments to get receipts again, people working again. You don't fight COVID-19 if you have no money, so the governments need money. So you got to find that balance. That's where we are with Restart, finding the balance and where you can restart your economy and do it in a way where you don't lose all the gains that we've made. And so that's what we've been working through, all this planning and preparation. So social distancing is going to be part of us.
We saw the success of Pizza Free last weekend. It's going to happen again this weekend. If other food businesses are inspired by that, to take out food trucks and try more mobile service options, are there limitations against that? Are they allowed to as long as they observe social distancing?
Yeah, I think, well, you need a permit to do it, right? So you can't just go out and do it. We're not going to go tackle lemonade stands because it's not that time of year yet. But certainly we saw the demand that Pizza Free brought. Certainly there were a couple pictures, cute little girl, but her mask wasn't over her nose. I got a lot of emails about that. We're going to have, our health department's going to work with these things now that we saw the reaction from the community to make sure we talk to the business during this process. We want these companies to do well. Certainly people being able to get Pizza Free. We talked about how good Pizza Free is. Actually, it's so yummy. But we need we need people to be doing the right thing. And if you're a business now who's doing this, part of your mandate is you have to regulate social distancing. And so that's the new norm. And so if you can't regulate it, then you're going to have a problem because you're going to get regulated.
I'm going to tweet that direct quote, "So yummy."
It's very yummy, Andrew, at Pizza Free.
In terms of reopening, when do you hope to see phase 1 kind of begin here in the county?
Well, I think the governor has been very clear that May 15th is the earliest that they're going to do some things. So we've been preparing for this. We're both Central and Mohawk, County Executive Pacenti and I, with all of our different county leaders and mayors. So we're working through details and logistics with the state, starting to answer questions, which is part of this process, and hopefully the state will be comfortable with our planning process, and they believe what we can do a restart on the 15th in a safe way. I think the state's also been, we're talking about a restart phase 1, but there's also been some loosening of regulations, which allows essential businesses to, and mind you, any business is essential. This is what the definition is that people have been using. I'm not suggesting some other business is not essential, they are. But these businesses that are in business today, by loosening up regulations on some of them, that helps the economy get going. Elective surgeries. Certainly we think there are some other regulations that we'd love the state to consider as part of all this process.
What What are some of those regulations on some others besides elective surgeries?
Showrooms by appointment for auto dealers. I've said that for 2 weeks, and to my friends at the state too for 2 weeks. So hopefully they'll grant us that.
Do you need a car?
I don't need a car, but certainly the argument is being made that if you're going to Walmart or Wegmans, and there's lots of people in a big showroom, probably as big as this, as you have a one-on-one appointment, there's a way to stay 6 feet apart, right? So I think it's a good point, and I think that's an important part of the economy, bring people back to work. When you look at our economy, the number one driver of sales tax is the automotive industry. So some people, we've talked about this before, have emailed me saying I'm very greedy for wanting to do that. I just want to remind the taxpayers that we have to find this balance, and we need money to pay our health department and to pay for the sheriffs and to pay for all of our frontline workers in government, and how we get money is this economic activity. So if you can do things safely and social distance, we need to start looking at doing that in a controlled fashion. So certainly I think this is one aspect that hopefully will be considered in a restart, if not sooner, because there are already businesses that are allowed to operate. You're just allowing them to operate a different way now.
One of the logistics for the restart that the governor talked about today too was having isolation facilities so that people can be isolated away from family or housemates. Is that something the county is developing?
We already have them right now. We don't broadcast them, and so we already have these partnerships today, so that's something that would not need to be done.
Is anybody using those?
Sure.
To be,
we talked about our program for essential businesses with our employees, with hotels. We've had people in the community at times that need to be in a quarantine. Maybe their housing isn't stable. We deal with that. So we have partners already that have been doing the exact same purpose. So when you look at, we liked today's conversation. It gave us some new information for us even. So we can check that box. We already have those facilities.
how much capacity do we have in round numbers?
We're talking about essentially hotels, right? And renting hotels and various facilities. So we have lots of hotels right now that have capacity.
How about, he also talked about a regional control center. Are you guys looking at that? Have you had conversations about possibly being a regional control center for?
Yeah, so we have, many of you saw it, our EOC certainly fits all the criteria for a regional control center. At some point, there may be conversations about something that brings in various partners, maybe long-term strategies to do something different, as this is a new norm. But certainly our EOC has been up and running. Many of you toured it, there's representatives from all governments, all agencies, all working there. Our EOC will certainly be the near-term answer to the regional facility.
Ryan, the town of Onondaga has gone from 36 cases to 68 cases in a span of 6 days. What can you say about that jump?
Certainly, those are affiliated cases for the most part. I can't say every one of them is affiliated case, but they are affiliated cases. So not community spread. And I had people from the town email me that. A lot of people emailed that question, but we're not going to pick on a specific building or two, but they are affiliated in our senior living bracket.
Any reports of nursing homes in Onondaga County or senior living facilities not complying with the state's 24-hour mandate of notifying loved ones if their patient has succumbed to the virus or if they've tested positive?
We've not been aware of those reports. Certainly, I think over the last 2 weeks, the situation in the partnership working with, in a proactive way with all of our senior facilities in the county has improved tremendously. And you learn from other parts of the state and what they do well and what they didn't do well and what they could have done better, and we try to implement them here. And our proactive strategy isn't just us. New York State's been a great partner in that as well.
You mentioned car dealerships by appointment. Could you envision something similar to reopen Destiny USA?
You know, when you think about the mall, it was one of the last businesses that was really towards shutting down, and people say, how could that be? A lot of people could go. It's probably one of the easier places to social distance if you think about it. It's so big. You can stay 6 feet apart for the most part on most days. So that type of facility will certainly be in later phases due to the number of people. And one of the reasons why we shut down the mall when we did is because we shut down schools. And there was a real concern about kids going to the mall and hanging out and gathering. And certainly kids, the concern was that they would not be as easy to get to fall in line with social distancing. So that's why we did what we did, really. That was one of the driving factors. On a restart, I think it will be interesting with younger people. They get it now. They know about it now. This isn't brand new. Most of these young people have seen news reports and they understand how deadly this virus is. So I think that will have an impact on their behavior moving forward. Certainly masks will be part of the equation. That will be helpful. Destiny's a big part of the local economy. A lot of people work there. We need to try to get our economy back and running as soon as it's safely possible. And so we know it's easier to start with different economic sectors than others, and certainly lots of people under one roof will be later on in the process.
You've renewed your executive order closing malls. Is that currently your jurisdiction, or is there a state equivalent to that would supersede?
It's a good question. We're doing it for a reason, so we believe we have some jurisdiction over it.
Are we, if we are to have, I think it's 30 tracers per, I'm forgetting now, 100,000
Yeah.
population, so that's maybe 140. Would most of those have to be supplied by the state through their arrangement with the SUNY and CUNY schools, or?
So we hope that with this new initiative we'll get a lot of tracers, Tim. But what we're doing now is we're not going to wait for that. So we're going to cross-train existing county employees on tracing so that we have that capacity to meet that mandate. But certainly we don't think under the current data that you need 140 people tracing every day. If we were ever in a situation where you saw hospitalization rates start to go to 50, 60, 65%, and you saw the cases get to close to 1%, the way the governor was referencing, certainly you need to be tracing and quarantining any potential person any risk, right? But we understand the mandate. We understand the numbers. We will have folks that can do this to meet that mandate by May 15th.
What's your target number to get up to?
I think whatever the mandate is. 140, I think, was the number that we came up with. So that's what we'll do. Again, right now we already probably have 50 people doing this on a team. So we talked about our COVID-19 tracking team. That's going to be new people. Then we'll cross-train county employees. Part of this effort, when you're shut down like this, is you have different employees doing different things because there's different needs. So there's a lot of talk about Reimagine New York as a way of coming back and relooking at the economy. Governments are going to be in the same position when you look at the new demands on them and what people were doing and what now they may be doing may be different.
Last time I was in your health department, you had rededicated almost the entire staff to fighting COVID-19. As you transition the structure of the department, will there be other projects that just need to go on the back burner within the health department? I mean, you'll still have mosquitoes this summer, right? Food inspection, things that have to continue, but will anybody change jobs permanently?
No, I think what we'll see, Andrew, is I think this virus is going to be with us one way or the other, even if the virus flies away for 2 or 3 months and then comes back. Our planning and preparation will still be extremely intense, but we have certain mandates we have to meet. So you mentioned mosquito spraying. We're very concerned about things that cross-connect between departments, child abuse. Right now we're very concerned about that. We're very concerned about mental health during this as a direct impact on this. So looking at suicide rates, looking at opioid rates, these are all things that are going to still be things we have to work on. And then we have folks that are going to have to focus in on other infectious type diseases and planning and preparing as well. So our health department is going to be very busy. It's an area of the government that's always been critical and important. When I was on the legislature, that was an area that you never messed around with health when you looked at budgets and you looked at the executive bringing you a budget. You don't go cutting your health department, right? Now our health department's busier. We're going to have to look at rearranging the deck of county resources to make sure that they get the resources they need in these times right now, these pandemic times.
You pointed out that the percentage of active cases that end up in the hospital or the ICU are both down pretty significantly. What does that mean? Why is that?
Well, unfortunately, part of this is they go down when you have discharges, but they go down when you have deaths as well. So part of it is why those numbers are so important, because it's a metric on whether or not your medical infrastructure is being overrun by this. And it allows you to forecast ahead to make decisions like elective surgeries and other things. So the ICU beds being as low as they are is good, because that means there's a surplus of ICU beds. It's bad because some of the reasons why people aren't in the beds anymore is because they're not with us anymore. But people are getting better, they're recovering, but we're losing people. And so these rates are important to any sort of restart, important to elective surgeries being allowed, because you need those beds for COVID patients if the demand is there. We're seeing the demand down because overall our cases aren't coming in as fast as they were. And some of the cases are coming in and these folks are never getting to the hospital, and we're seeing recovery. So it's a lot of reasons.
Yeah, that's what I was wondering if part of it was, it's being caught earlier and treated, more effectively because it's covered.
I think it's easier, and especially with some of the proactive steps that we're taking now and finding this, I think that will help with some of the hospitalization rates. I'm really concerned, we've talked about this, but I'm really concerned that we'll lose more residents of the community just looking at the demographics on where the positives are coming from now. They were 27, now they're 34, over 60. I'm very concerned that we still have dark days ahead in this fight.
When do you think you're going to get the total number of tests from the Walmart site and the other sites? Because one of the criteria for the CDC reopening guidelines is percentage of tests that come back positive.
We have all those, so we always have the positives. So it's only the negatives that we aren't getting.
But if you don't have the negatives, you don't have the percentage, correct?
Oh, no, so the CDC guidelines is a trend. You need a downward trend on positive cases. So if we already look at our trend from our peak, we've had a downward trend. Even on days where you go from 22 positives to 25, that doesn't mean you start a new 14-day period. It's a downward trend, not each day. But the that's related to positive cases. So we get our positives in real time. That's why we aren't giving you our percentage. Usually, remember, we're talking 7.8% of our tests are testing positive. I can't give you that right now because I don't have all those negatives yet. So our percentage is skewed because I'm giving you all the positives in the community, but I can't divide those by all the negatives because I don't have all the negatives.
Is that just the effect of Walmart, though?
Walmart, certainly, it's harder to track some of the state's testing that they do, and we get the positives, but we don't get any of the negatives. And it will be, again, we talked about the pharmacies that are coming online. I don't know, that would be a challenge to track all that. At some point, that all goes into the state system, and it all gets caught up with, but that system right now is days behind when it comes to our county's data. So it's hard to differentiate all the data. We had a very good system going on. It's easy to do it when you got 5 partners. When you have 149 partners, it becomes a lot of work.
Have these partners reported to you and the state in 2 independent ways for you to give us data first? What's the workflow been like?
Well, not all of them. A lot of them aren't online yet, but even the Walmart one, we're getting their positives. They've let us know. They're updating us periodically on all the tests that have been done, but we're not getting the negatives back in real time, so it's hard to give that. We get from the hospitals, the triage site, on a daily basis, all the positives, all the negatives, and what's pending. So we don't know the pendings or the negatives from the Walmarts. We don't know pendings or negatives if the state's doing testing in any of their facilities. And when these pharmacies come online, I don't imagine they're going to be 149 different locations are going to be calling us saying we did this many tests today, this is pending, and whatnot. So I think this number overall, the information that we've been able to give as accurately is going to be harder related to how many tests are being done. We're going to have to, if there's going to be a mandate on doing 13,000 or 14,000 tests a month moving forward in a proactive fashion, we're going to have to work with the state in figuring out how we can know that number is actually happening based off of, because the demand's not going to be there for 30 days. If the demand's there for 30 days to do that many tests, that means we got a real problem. So I don't think we're going to have that problem. So that means we're going to have to be proactively testing so many cases. And so we'll iron out those wrinkles. And that's what the next 2 to 3 weeks is all about. Any other questions? Related to masks, this is kind of our good news. We are going to be distributing thousands of these masks right here, these cloth masks. 5,000 going to the Housing Authority, 2,000 La Liga at Spanish Action League, 2,500 to the Near West Side Peacemaking Project, 1,000 to the Southwest Community Center. Centro is getting 5,000 of these for the bus riders. Clinton Plaza getting 300, Valley Vista Apartments 200. We're getting these to food pantries. We're getting these to over 5,000 of these to senior living centers outside throughout the county, locations throughout the county. Vera House, McMahon, Ryan will be getting these. I've gotten a lot of emails about people going into retail stores not wearing masks. We're going to get these to grocery stores. We're going to get these to Walmart. There will be no excuses for why folks don't have a mask, because we will have them for you. So that is the good news. That will create, that will help address a lot of anxiety and probably prevent hundreds of emails to me complaining about people not wearing their mask when they leave their house. So again, I think overall, in this fight, we're going to have, each day, we're going to have some things that hurt, and we're going to have different things that are positive. And so certainly we had some positives today, but my heart goes out to all the families that have lost loved ones, and I know how painful this is for you, and our thoughts and prayers are with you. Thank you.